Thank you to the ranking member. Also, thank you to Chairwoman Johnson for allowing me to be a doctor today. And yeah, I think there are a couple hearings happening on the Hill today. I think this is the most important hearing that's taken place actually today, and I think that's why all the cameras are out in out in Longworth. Just thinking about it to both Dr. Fauci and Dr. Jernigan, my home district and my home state senator is Dr. Richard Pan, a colleague of mine, and we're on the front lines of trying to combat some of the disinformation that is out there. And I just want to run through a couple quick yes/no questions. Is there any scientific evidence that vaccines lead to increased risk of autism, Dr. Fauci?
Absolutely not.
Dr. Jernigan? When I was practicing, I would talk to some of my patients. They would often come back at me and say, well, I don't want to get the flu vaccine because I had it before and it causes the flu. Dr. Fauci, is there any evidence that the flu vaccine causes the flu?
The flu vaccine does not cause the flu.
Dr. Jernigan?
I agree, the flu vaccine does not cause the flu.
Great. The whole point of science is to pursue the truth, and I think it's important for us to dispel some of these myths. There are legitimate reasons for a small cohort of individuals, if they have allergies to eggs, et cetera, to opt out of the vaccine. But one of the most important things about why it is important, let's use measles as an example, to vaccinate a large population of folks, is the concept of herd immunity. And I think it's important for the public to understand that particular concept. Dr. Fauci or Dr. Jernigan, whoever, would you,
It's a very important concept, not only for flu, but I mean, our recent unfortunate experience that we had in this country, particularly in New York City, in the Williamsburg section, was a classic example of what happens when the umbrella of herd immunity goes down below a certain level. Because you had a community in which the level of vaccination was somewhere between 70 and 80%. For measles, you need somewhere between 91 and 93 or more % of the community, so that when someone inevitably comes in from the outside or someone travels and brings back measles, if the community isn't protected by that herd immunity, you get the very unfortunate situation which we saw in the Williamsburg section of Brooklyn.
What are current measles vaccination rates in America?
It's over 90%.
Okay, so we want to keep that.
Right.
And measles was a disease that, for the most part, we had eradicated in America, and now we're starting to see that, the incidents starting to pop up again. I guess for Dr. Jernigan, I'll often hear individuals say, well, we don't really need these vaccines or the flu vaccine because we haven't had a pandemic like the Spanish flu for 100 years. Can you talk a little bit about why we've been so lucky?
Yeah, so I think with the pandemic influenza, this is a situation where the flu viruses that are actually circulating in animals can actually mix with those flu viruses that are in humans. And when they do that, they can they share their genes and can create a flu virus that has not been seen before. That means that it can spread very quickly through the community, and often it can cause severe deaths and illnesses and hospitalizations. The 1918, like was mentioned, was one of the worst. That one clearly caused at least probably 675,000 deaths in the United States. We've had 3 other pandemics in the last 100 years. Those were with changes in the vaccine that were not as bad. We at CDC have looked at the 1918 virus and found that there are particular changes in that virus that really made it severe. So there's nothing preventing that from happening again. So for us, it's important to maintain the vigilance so that we can see what's happening, maintain the ability to have vaccine available quickly so that we can get it, and be able to prevent influenza and severe influenza if we were to have another pandemic.
And in today's interconnected world where people move across boundaries, having 2 big oceans are not necessarily protective for us. Dr. Fauci, you and I had the opportunity to work together around the 2014 Ebola outbreak in West Africa. Can you talk a little bit about the evolution and development of an Ebola vaccine and how that's helped us, in the 2017 outbreak in Western Congo and and given us the ability to better manage Ebola?
Well, back in the 2014 to 16 outbreak in West Africa of Ebola, during that period of time, we, together with a variety of other agencies, including the CDC and other international agencies, began the testing of a vaccine called VSV, which now is ultimately made by the company Merck. So at that time, we did phase 1 studies right here in the United States. We did it at the NIH on our campus. Some were done in Europe, and then we did it in West Africa. We advanced to phase 2. The CDC did a study in Sierra Leone. We did one in Liberia, and then ultimately it was shown in a ring vaccination study in Guinea to actually be effective in preventing infection, particularly those who were exposed. That vaccine has now been used in the Democratic Republic of the Congo, and over 245,000 doses have been given in a contact ring vaccination approach. It is very clear that if, in fact, we didn't have that vaccine, we would be in a much worse situation than we found ourselves in the Democratic Republic of the Congo. And as you well know from the reports coming out from the CDC, the number of cases per week of Ebola have gone down and down and down. We're not through with it yet. It's still there, but the vaccine has played a major role in being able to prevent the explosion that we saw in West Africa.
Well, Dr. Fauci, Dr. Jernigan, thank you for your service to our country. And just in closing, vaccines are safe, vaccines are effective, and vaccines save lives.